been involved in this extraordinary American initiative. I also want to recognize members of my administration who have worked tirelessly in this effort. Alex Azar, please, Alex. Where's Alex? Thank you, Alex. Effective, which is a number that nobody expected to be able to get to, far exceeding anything that really that anybody thought. We went out and we said, what do you think a maximum would be? And I think doctors, we all came up to the conclusion that something like that would be really incredible. We're going to show prior to my coming, you saw that very few people thought that this was possible. Of course, they'll be saying now, we always told you it was so, but we have them saying a little bit different. But it has been incredible, and it will end the pandemic. It will end the pandemic, and we're working with other nations, as you see actually by looking at your screen today. We're working very closely with other nations also to get the vaccines out to other nations in the United States. Despite the grim projections from the media 8 months ago where they said this was impossible, they actually said, and you saw that a little bit, but I could give you so let's see here. I guess we have to do it like this.
So I think Dr. Slav alluded to this, but I'll just kind of try to say it in a different way. You know, normally vaccine development is something that is de-risked so that one completes each step, stops, looks, then goes to the next step, stops, looks, then goes to the next step, and at the end of the process, one really ramps up manufacturing. What was done here is instead of that serial one after the other process, many things were collapsed and done at the same time. And I think General Perna noted that instead of waiting till the very end to decide how you're going to distribute the vaccine, instead of waiting till the end to decide that you're going to manufacture large amounts of vaccine at risk, these were done at the same time. And what that means by doing things in a parallel manner is that corners were not cut here. This is a vaccine that's gone through, these vaccines are going through the large kinds of trials that we would expect from prophylactic vaccines, preventative vaccines that are going to be given to large numbers of people. Just to give you just a number, the average vaccine development program for the kind of prophylactic preventative vaccines that we're talking about is about 21,750 people enrolled. So these programs with from 30,000 to 45,000, 44,000 patients enrolled or individuals enrolled, that's a pretty nice size program. And so that's giving us kind of the gold standard types of a clinical trial program that we'd like to see for preventative vaccines.
Secretary Azar and our governors, as you can see, no one knows better what their communities will need than the folks who are closest to it. And General Perna and I often share a phrase, and that is, you can never let your reach exceed your grasp. And I think the federal government understands where its reach ends and where its grasp ends, and where we have to hand things off to our governors, our mayors, and our county commissioners. I think we started the session today by talking about 3 objectives. Maybe just take a moment to review those. One was to build a better understanding of how we're going to get safe and effective vaccines to the American people, anyone who's desiring one. I think the second one is build confidence as the Trump administration is following data and science in the evaluation and development of these vaccines. I think Peter Marks did a terrific job there. And then the third was, again, to recognize achievement, which is all of the private sector innovation, all the commitment, and the American spirit those working with the Trump administration have demonstrated every step of the way to help us get these vaccines out safely. I think he said you can see a lot by watching. And as I introduce Vice President Pence, here's a guy who has tirelessly led the White House Coronavirus Task Force for the last 7 or 8 months. And you can see a lot by watching him. This is a multi-agency response. It's the Department of Defense, it's the Department of Health and Human Services, it's the Treasury Department, Secretary Mnuchin, the Labor Department, Department of Homeland Security. And this needed someone who could bring all those folks together and get them to collaborate, get them aligned, and the Vice President was great at that. He's also a former governor. And what you just heard, Secretary Azar talk to the governors about, their role has been in our response and will be absolutely crucial to successful vaccine administration. And the guy is an optimist, and good leaders are optimists. We visited a plant but I told this story before, and I'll tell it once more. When I first met him about a year ago, I was in the West Wing, and anyone who spends time in the West Wing knows there's some extraordinarily bright, energetic, but extraordinarily young persons there. And I was in a room, and he walked up to me and he whispered in my ear, he goes, "I'm glad there's someone else with gray hair in the room." So I'd like to introduce the other guy with gray hair to close out our summit, Vice President Mike Pence.
Today, members of Congress, to mayors and state and local officials, especially health officials from around the country, thank you. Thank you for your role in bringing us to the precipice of a breakthrough in American medicine and in the life and health of the American people. We are literally days away from the fulfillment of the vision of Operation Warp Speed. And I want to thank you for participating. And I want to thank all of you who've looked on from afar to take in this vaccine summit. Families that have lost loved ones over the course of this year. Even as we enter a time of great promise in this country, I want families that have lost loved ones and those that are still struggling in the midst of this pandemic to know there's not a day gone by that you haven't been on the hearts of all of us working at every level. And we will never forget your families or your loved ones as we hasten the day that we put this pandemic in the past. Days ahead. My wife and I ran a marathon about 10 years ago. And the records in that marathon were all intact when we finished. And I will tell you, they told us when we were running that the last 5 miles of a marathon are the toughest. You come around that corner and after that 21st mile and you're absolutely convinced that you never felt better in your life, you can see the finish line and then your legs start to tighten up. The truth of the matter is we've been running a marathon in this country, haven't we? But I want the American people to know the finish line is around the corner. We can see it from here. And by the spring, we anticipate, or shortly thereafter, we'll have what we believe will be multiple safe and effective coronavirus vaccines for every American that wants one. Can't help but think of that ancient verse that says, "Do not grow weary in well-doing, for in the proper time we will reap a harvest if we do not give up." Now's the time for us to stay focused, be encouraged, because the extraordinary innovation, the dedication of health officials at every level, these great research companies, our extraordinary private partners, We are literally on the cusp, putting the coronavirus in the past. We are coming very close in the days ahead, I believe, to the beginning of the end of the coronavirus pandemic in America.